Hello, everyone. Welcome to the MsTexasShow with your co-host, Elena Georgiou, and excited as always to bring you another edition of our show and another wonderful, wonderful guest. And that guest today is Kristine, and she's a diploma holder in health development, member of Yakhama Country Education Board, representing child rights organizations, network, and World Pals Ambassador. We're super excited to have Kristine with us today to tell us more about her story, her journey, and all the wonderful things she has done and the wonderful ways she helps others.
The Ms. Texas Show is a voice of hope for victims, survivors, advocates, and community leaders against gender-based violence to share their stories and resources. We began showcasing life in Texas. Today we are impacting lives not only in Texas, but also around the world. Under our segment Military Time, we run this segment in partnership with the National Veterans Chamber of Commerce. We invite military and veterans who have overcome traumatic events to share their experiences during and after their military service. Under our Beauty segment, we invite fellow pageant winners and contestants, artists, musicians, actors, models, and dancers, and last but not least, our survivor leaders from family violence, sex trafficking, sexual assault, stalking, and other traumatic events who are ambassadors for these causes to share their lives and the impact they have made. To become a guest on our show, email us at MsUSATexas@gmail.com. If you would like to support victims and survivors of gender-based violence, make a tax-deductible donation to Hope Picks Global at www.hopepyxglobal.org.
Hello again, and welcome to the Miss Texas Show. As always, we're not only excited to have another great conversation, but another incredible guest. So our guest today is no less of an honor and pleasure. We have Kristine with us today. She has initiated a land watchdog women's group, Girls Forum, and Village Saving and Lending Women's Group. And we're super excited to have her with us today and super honored. And you have definitely had a tremendous journey and a lot of experiences, and you have done so much to help so many others. So Kristine, if you could, let our viewers know about yourself, who you are, a little bit about you, your journey, and more about you.
Thank you, Elena. My name is Kristine Yakhama. I'm a community health volunteer and social worker in the subnational level of Kakamega County in Kenya. I work with women, youth, and children. Part of the work that I do, I work closely with women, especially women caregivers. Women are the backbone of the economy in my county, and they are most vulnerable in the community. Women are associated with being in the kitchen. They are supposed to be seen, but they're not supposed to be heard. Women especially work in the community, whereby they do work in the mining sector. In the mining sector, you find they are not allowed to reach where the gold is being mined, and they are supposed to move where light work is, whereby now what they do, they need to grind the gold, and through when they grind the gold, it affects their health because of the silicosis. And this silicosis is causing harm to their bodies. To others, it has developed TB. And after doing the crushing of the gold, what they do, they need to clean it. And how they clean it using mercury with bare hands. What established this data that we found out is we were losing a lot of women through TB. One of the things that I always do is every month I conduct community dialogue in the community. Through this community dialogue, is when I established during one patient who had defaulted her TB drugs. When I asked her why she defaulted, she told me she cannot take drugs in an empty stomach. I decided to do home visit to establish why she's being resistant to the drugs, because when you default TB drugs, it becomes multi-drug resistant. And that one is bad because it spreads fast to the community. So what I did, I went to that community where the lady lives. It's very unfortunate that this girl, she lives with a sister, and this sister of hers, she's a mental case. Now what happens with the sister is, when this sister of hers was not around and she felt like she's having an headache, she would go and take the drugs of the sister. So it became a challenge. And one of the things that I did, I decided to collect specimen of the people living around with these women. The community were very hesitant. They didn't want, because when you tell them you want to collect their samples, they associate TB with HIV and AIDS, of which it's not the case. I told them, it is good first I get the specimen to ensure that they are free from TB. A few households agreed to give me their specimen, and out of the samples that we collected, we found like 5 others had contacted the TB. What we did now, the 5 took their drugs well, but these 2, the sister and the one who had mental case, I had to visit one of the hospitals, that is Kakamega County Referral Hospital. I expressed to the superintendent the issue at hand. And you know what, in Kenya, what they've done? They've banned isolation wards in health facilities, especially for TB patients. But now for this case, I had to appeal to them, and they agreed. They kept these women in the isolation, and after they kept in isolation, it's when they were able to take their drugs well, and they stayed there for 3 months. And when they came out, they were well. Coming back to the women in the gold mine as well, most of the women were giving birth to children with defects. And others, you find that now, their children now were doing child labor in the mine. And malaria cases were high, because when they dig the hole so that they can enter to go and look for the gold, they normally don't cover the holes. Thus, malaria, it becomes a malaria breed for the community. What we did now is, we decided to conduct mapping in the community. There was a bit of resistance because people thought that we were coming to exploit the women, and that was not the case. We decided to have a meeting with them. We feel what they are going through and see if we can come up with an alternative way of earning and living. It's when we clustered these women. When we clustered these women, they came up with groups. Through the groups, it's when we initiated for them income generating activities, whereby others decided to do sweet potatoes, others arrowroots. The money that they get, it's being plowed back to the activity of arrowroots or sweet potatoes. They have merry-go-round tables whereby they give each other money. And then others can also do what? Borrow and pay with some interest. And then at the end of the year, they share the interest. This has helped them. They've been able even to come up with a cooperative society, whereby now they've even bought their own land, and they're now even thinking of coming up with bricks so that they can build decent houses. The challenge we are having is our county is unable to run mercury tests, because we need to establish the content of mercury in their bodies. We sat down with these women. We read a petition to the Senate. The Senate now summoned the Cabinet Secretary for Health. It's when now the elections were conducted in this August, they were unable to come and carry out the samples of the test. So last month, we were able again to revisit the petition. It's when now we have a new Cabinet Secretary, and she'll be in Kakamega this week on Friday. So we'll be also able to share with her again the petition. And I believe in the next visit when she'll be coming, she will be able to run for us the samples of mercury to enable us begin treatment of these women. We have women, we also live near the forest, the only tropical rainforest in Africa, that is Kakamega Forest. At the moment, we are having drought until April when we'll have the long rains. It's when people will be able to go for casual work. What our women are doing, they go to the forest to collect firewood. When the forest wardens happen to arrest them, these women, in order to negotiate for their freedom, they exchange sex for firewood. They are unable to negotiate for safe sex. Last week, we had World AIDS Day. It's unfortunate that women were the leading carriers of HIV. Thus, and there are others who haven't even gone for testing yet they have the symptoms. What we are trying to do now is we are trying to work with the Ministry of Health hand in hand and develop support groups for those who have already. But now the challenge we are having, they are feeling stigmatized. Because when you go to health facilities, where they go to collect their drugs, people living with HIV, it's a standalone facility. Now they feel bad if somebody sees you going there for your drugs, they imagine that you have HIV. That's why now they even default. Now we've come up with mentor mothers and peer educators. Through these mentor mothers and peer educators, they are able to do home-based care, whereby they'll go to this patient's home, they ensure that they're taking their drugs well, they ensure that they're eating well, so that we don't have losing anyone through HIV. And we're also training them about prevention of mother-to-child transmission, whereby we have the dialogues, and also through the support groups, we ensure we reach them and give them the support that they need, especially the moral, spiritual support that is key to them.
Wow, it's so incredible. And this world needs leader women like you. You have done so much. I mean, I'm impressed. It's incredible. And keep doing what you're doing. People in Kenya, they are very lucky to have you. And I just want to ask you, what target group is more at risk? I mean, you haven't said anything. It's about women, or what about the girls? What kind of challenges the girls in Kenya face? I mean, do you have, if I understand, do you have any gender inequality, and are they facing any biases in healthcare maybe, or education, and or only just tell us about all this, about the
On
child,
education,
the children, I mean, the girls.
on education, they value the boy child. Why do they value the boy child? They believe if you educate a girl child, she will be married off and goes and develop where she'll be married. In Kenya, education is free. But now the challenge we are having is it's free at the primary level, but now they've introduced something we call curriculum-based competency, where parents are supposed to pay, but parents are poor, they're unable to pay. So what they do now, with this free primary education, you find parents will take the girl child to work as a house help. Her salary, they'll tell the employer to ensure that he sends it back to the home so that they can take the boy child to school. I've talked about women going to the forest for firewood. Our men normally go and pluck tea. When they go to pluck tea, they enter there at 8. They are given breakfast, they are given lunch, and they are given money. But this money, they won't take it to their homes. Instead, they'll go and drink an illicit brew called changa. So when this woman, in the morning, she has to wake up as early as 4 a.m. to go to the forest to collect firewood. She comes back in the house at around 9 a.m. We have a problem with our houses, whereby you find children are sleeping with the parents in the same house. With the poverty rate index, they can't afford a mattress for the children. So they'll put a gunny bag and one blanket whereby these children share. The parents will sleep in a room, in the room next room, and then they have the kitchen. Now you find as the mother has gone to collect firewood, the father, the illicit brew now comes to end at around 4 to 5 there. When he tries to look for the wife is not there. He resolves now to get rid of the girl child. He'll tell the boy child, go and buy milk somewhere far, and ensure you go and bring the milk from that place. He then picks the girl child, he defiles the girl child, and he tells the child, in case you tell your mother, I'll kill you. Now it reached a point whereby you find this child will be mishandled by the father to an extent that they damage their vagina. You find that even now the child finds it difficult to walk. It's when now you'll find a neighbor or a close friend of this child will come and tell you, there's this girl who has this issue. When you come and talk to this girl slowly, she'll tell you, this is what my father does to me. You take this child to the hospital, you'll find that she has been ruptured. The challenge we are having is we don't have a safe center for children. So what you do, you'll pick the case. By the time you take it to court, you'll find it will go for the first hearing. The second hearing, they won't turn up for the case. They go and negotiate it outside the case. That's what we call kangaroo courts, whereby now the mother now will be warned. If this case continues, we won't allow you to stay here and our son is in jail. So you need to decide. Now you find this child will also become an abuser. She'll go to school again, she starts abusing her fellow boys. For now, I can tell you, like in the recent 1 month, we find that some girls have been defiled and infected by HIV. The same girls have infected the boy child. You can imagine the kind of situation you're headed to. In August, schools closed for 1 month. And it was so bad that underage children were leading in sexual transmitted diseases. 2, one student, a very bright girl who schools in Kumu Girls, was unable to get sanitary towels. She exchanged sex for sanitary towels. She became pregnant. People gave her herbs. When they were doing referrals to take her to the referral teaching, she died along the way. Right now, as I'm speaking to you, schools closed last week, and they are opening around 27th of January. What will happen to our children in between? One, we are worried teenage pregnancy will increase, defilement cases will be high. I'm working on a program on diabetes and hypertension. I've decided during this holiday to mobilize children to become diabetes hypertension army, whereby they'll go and train other champions to be engaged during this holiday. Otherwise, if we don't engage these children, there'll be a problem. This is the generation we're expecting. It's so sad. We are losing a lot of children at a tender age. It's so sad. The situation is out of control. And in Kenya, they are saying in Constitution Article 43, the right to health, including sexual reproductive health rights. But the challenge we are having is they've banned contraception to children. Children are not allowed to use family planning until they reach the age of 18. What are we going to do with our children?
So the situation is really bad, and as you said, there's child sexual abuse by the father, or women are being sexual abuse as they go to pick the wood and at the forest. So the situation is really bad.
A real big problem in my community. And at the moment, we don't have enough. Most of the development partners during COVID-19,
Yes.
they are not funding most of the programs. So what we are doing, we are just struggling in the community.
What are the struggles except for financial struggles? I mean, have you, like a woman, do you have any rights to have a voice in the matters of the state? Maybe not in courts, I mean, as you go to have meetings, maybe with the governor there, how do they see you? Or because you're a woman, what is the reaction?
Okay, in Kenya, we have two levels of government, the national and the county government. The children's is not devolved, but on health, health is fully devolved. It's fully devolved, but there are no resources. Late disbursement of money to the counties is a challenge. Issues to do with stockouts of drugs, commodities is a problem in our health facilities. If you look at our data, people are avoiding to go to level 4 and 5. They go to level 1, 2, and 3 because it's free. It's free, yes, but there are no drugs, inadequate staff. Now you find people are just dying because of simple ailments. Look at the children's department. The only focus is about capitation, that is free education, and then about giving books. But there are no curriculum activities in these schools. We have the Basic Amendment Act of the Basic Education Act. It is saying all children are entitled to sanitary towels, but they're not being given. It's never implemented. We lobbied last month when they were doing public participation on curriculum competence. We asked them, what about these sanitary towels issues? It's when they told us, at the moment, the government doesn't have money, yet we are paying taxes. It's so sad. County governments, we normally push for budgets. The challenge you're having even with those budgets, you'll go and participate. Implementation is another challenge. We have what we call the National Health Insurance Fund. This money, we contribute when they deduct us and even the others who pay self-employed. The challenge with this money when it comes to counties, it comes as a source of revenue. It's never plowed back to the health facilities. When it comes to the counties, they take it for political mileage. The same politicians and our leaders, when they are sick, they don't go to public hospitals. They go to private, or even they go to India. And here we are the ones who are paying the taxes for their salaries. They are very inhuman.
And what about domestic violence? What's the situation in Kenya? We have
Domestic
child
violence.
sexual abuse. What about the women? Or there's increasing violence, or
Violence is very high, especially now, like right now, I've told you, we are having the drought season. There are no money, there are no jobs, casual jobs. Now you find like the men are always the head of the families. Without drinking the illicit brew, what they normally do, they'll find like the wife has put a lot of efforts in rearing chickens, bananas. When they come and find like the wife has gone to fetch water in the river, they get hold of the chicken, they sell it so that he can go and drink the illicit brew. Even the banana you find like the wife has planted there so that it can be a meal for the children. The husband will take advantage and steal and sell it. It becomes a challenge. When the wife tries to raise her voice, she's beaten to an extent that she doesn't even know where she'll get help from. It becomes a challenge. The others even who have gone to an extent that even the husband cuts her finger or even cuts even the face. But by the end of the day, you find she returns to the same man in the name of the children. One of the things I always tell women, immediately your husband slaps you, the next time he'll give you a blow. The next time he'll cut you in pieces. It's better you leave that marriage and return to your parents and be at peace rather than suffering in silence.
So I want to add up to all this that you said, Kristine, about violence. And violence against girls is a violation of girls' human rights. And everyone has the right to live a life free from violence and the fear of violence. And anything that causes or threatens physical, psychological, or emotional harm to a girl, or limits her freedom of movement, or the right to an education, and results in a loss of her life, or takes away any of her international recognized rights, is wrong and must stop. And violence and discrimination have serious physical, emotional, and financial and social effects on the lives of girls and young women, and it costs countries billions in health and legal services, well-being, and loss of economic output. Furthermore, the emotional and mental impact on the girl and her well-being is untold. So gender inequality and discrimination are the root cause and consequence of violence against girls and young women. But unfortunately, no country in the world has achieved gender inequality. Instead, violence has a culture of silence surrounding it, and this violence may look different in different parts of the world, but still, the fact remains that Violence is a power relation between men and women, boys and girls, and everyone has a role to play in ending violence against girls and young women. And violence has to stop here and now, not tomorrow, but today. And child sexual abuse must stop, and children have to be protected. So as far as gender inequality in Kenya, there is an increase in child sexual abuse and domestic violence. There is also corruption in court cases of abuse. Also, women and girls face poor healthcare access and gender bias in education. There is no child center for children to have a safe place to go in case they are sexual abused, or for women like a shelter. The situation is worsening. So not only they're facing poverty and diseases, there's also gender bias for education for girls, but also they are facing either domestic or child sexual abuse. And this is so sad to hear this, but also it gives us the opportunity to see what's going on and to work together in creating a better world free from abuse for the future generation. So, Kristine, I wanted to ask you now about the gold mines and the women working there. You told us about the diseases that women are facing. Are they facing any other challenges, any gender pay gaps between women and men? Are they being paid less? Or what age are they allowed to work? And anything that you want to inform our viewers?
I'll begin by saying mining for gold can provide a solid livelihood for many living in Kenya's Kakamega County, but customary beliefs prohibit women from entering the mines, even on their own land, forcing them either to lease the land or leave the precious metal in the ground. What happens? We have those people we call sponsors. Sponsors are the ones who come to buy the gold. What they do, they take pieces of land and say that they are testing these women's land, but they don't allow the women to go near there. You find they use underage boys and youths to go to the gold mine, whereby now these youths, they extort them by paying them like 500 shillings. And for women now, their work is sluicing and washing the gold, separating. And then they're given from 100 shillings to 50 shillings. It becomes a danger. Why are they giving this boy 500 shillings? In case it collapses and he dies inside, that is it. It becomes a real challenge, and that's why now you find even these young boys who enter there and the underage children, most of them, they are rendered either infertile during the time when they want to have the childbearing age. It becomes a challenge. And then when they come out from there, they have to, in order for them to go inside those drilling the holes, they have to drink an illicit brew to keep them high so that they can work with a lot of efforts.
Okay. I want to ask you now about the impact your initiative is making, the results. What kind of results do you see in the girls and education you're doing and all this fight you're doing for their rights? What kind of results do you see?
The kind of results I'm seeing is children, especially the girl child, are going to school. Why are they going to school? These women, we've come up with an alternative ways of making a living. They are planting other roots, sweet potatoes, they sell, profit is plowed back, they get soft loans, they pay for their children's fees, and the interest and shares they share at the end of the year.
So Any other plans that you can help them out?
And
What are
other
you planning
plans,
to do? Anything else?
anything else we are doing, we have trained malaria army champions.
Mhm.
These malaria army champions, they are the ones now who, you know what happens in our country? They buy mosquito nets, insecticide-treated mosquito nets. But now our people, they were never sleeping inside the nets. Instead, they put their chicken, they cover vegetables so that chickens cannot go eat it. What we always say, they say, chicken outside, vegetables inside. Instead of a person inside the net, mosquito outside. Right now, they are spreading the message whereby now people are sleeping inside the treated nets. Cases of malaria have reduced. Cases of teenagers' pregnancies have reduced because now these children are also malaria armies. They are occupied throughout the time. They are never idle.
That's good. That's good to hear. That you're planning to continue doing new things there and helping the people there. And what's the message you want to share with the world, that you want to tell the world? And share anything you want to inspire people that are listening to us.
I will say, women are a nation. Empower woman, you empower a nation. We are trained through community dialogues. We are bringing male GBV champions so that these cases of GBV and champions, they're the ones who are now trying to educate their fellow men on how to reduce violence against women and treat women with dignity.
That's really good. That's a good message, Christina. Thank you that you have shared this and all that you're doing. I wish you all good wishes for everything that you're doing, and keep doing what you're doing. And thank you to our viewers for being here. And I appreciate for your comments, feedback, and wonderful support. I want to say goodbye and see you soon for another edition.